Can you hear me? Okay, this is the Baltimore City Council Budget and Appropriations Committee. I am Councilman Eric Costello from the 11th District, Chair of the committee. We are joined by Vice Chair Councilman Leon Pinkett, 7th District, Councilman Isaac Yitzi Schleifer, 5th District, Councilman Chris Burnett, 8th District, Councilwoman Shannon Sneed, 13th District, Council Vice President Sharon Green Middleton, 6th District, Council President Brandon Scott, Councilman Ryan Dorsey. And we have Matt Stegman and Nina Themlis representing Mayor Jack Young, Caitlin Young, Dominic McAlilly, and Rebecca Simmons representing Council President Brandon Scott, and Marguerite Kern, staff to the committee. Dr. Zaraza, you are up. And we're here for the health department. Dr. Zaraza, you are up. I think you're on mute.
Am I off now? Perfect. Good evening, Chairman Costello, Vice Chairman Pinkett, members of the Budget and Appropriations Committee, as well as Council President Scott and other members of the City Council. My name is Dr. Letitia Zaraza, and as the City's Health Commissioner, I thank you for this opportunity to present the fiscal year 2021 $169 million budget for the Baltimore City Health Department. Despite considerable obstacles, including an unprecedented cybersecurity crisis and a global pandemic, the Health Department remains steadfast in our mission to protect health, eliminate disparities, and enhance the well-being of everyone in our community through education, coordination, advocacy, and direct service delivery. I am thankful to have a team that has remained dedicated to this core mission, one that has sacrificed a great deal in recent months, with many putting in 7-day work weeks and 12+ hour work days for multiple months now to ensure the health and safety of our city. Joining me today are Malcolm Haynes, Chief of Staff, Mary Beth Haller, Deputy Commissioner for Youth Wellness and Community Health, Young Tan, Deputy Commissioner for Aging and Care Services, Jennifer Martin, Deputy Commissioner for Population Health and Disease Prevention, Leslie Thompson, Chief of Finance and Administration, Dr. Shelley Chu, Chief Medical Officer, Dr. Adina Greenbaum, Assistant Commissioner for Clinical Services, Kelly Eastman, Deputy Chief of Staff, Paul Nibber, Director of Legislative Affairs, and Jeffrey Amoros, Senior Director of External Affairs. For those Health Department staff watching from home or on standby, thank you all, and I sincerely appreciate your hard work. As with other city agencies, our staff and programs have had to make many tough decisions surrounding the COVID-19 global pandemic. Regardless, we have managed a number of great wins in just the last few months. Just last Thursday, June 4th, we announced the Baltimore Health Corps Initiative in partnership with the Mayor's Office of Employment Development, Baltimore Corps, Japigo, Healthcare Access Maryland, the Rockefeller Foundation, and many other funders to establish over 250 jobs to assist the city in contact tracing efforts. Our staff has stood up several COVID-19 community testing sites at Clifton Park, Druid Hill Park, and Pimlico. Additionally, we launched appointment-free, first-come, first-served mobile testing in the Cherry Hill, Highlandtown, and Brooklyn neighborhoods. These testing sites have been made possible through partnerships with LifeBridge Health, Family Health Centers Baltimore, the leadership of Sacred Heart Church in Baltimore, the Maryland Department of Health, and other community partners. We have even procured tests that will run in our testing laboratory to quickly turn around testing results. Our Division of Aging through the Maryland Access Point has dramatically increased capacity in order to meet the nutritional needs of thousands of older adults, helping connect residents with meal delivery services, and now providing over 10,000 delivered meals per day. In tandem with other partners, the Health Department has supported the establishment of several isolation and quarantine sites for our vulnerable populations, including a triage, respite, and isolation site at the Lord Baltimore Hotel, staffed by our Health Department clinicians, the Mayor's Office, Department of Transportation, our environmental health sanitarians, and the University of Maryland Medical System. By convening a number of public and private partners, we help support the 211 call-in line to assist residents in connecting with primary care physicians, finding testing and being scheduled for testing at our testing sites, as well as providing an avenue for residents to learn more about the spread and treatment of COVID-19. These previous accomplishments that I just reviewed have only just happened in the past 4 months. Prior to the pandemic, the health department was in our final stages of revamping an updated strategic plan after a fall community tour in which our team held 9 community conversations to gauge which residents identified as their most pressing health needs. Last year at this time, I praised our staff for being agile and improving health outcomes in Baltimore. The work done by this team has far exceeded my expectations, with over 300 health department staff redeployed to support mission-critical operations during our pandemic response. Our COVID-19 work is far from done, but our staff are fully prepared to take on the city's next phase in recovery from this pandemic, including assisting restaurants and other businesses in reopening, conducting additional testing and expanding contact tracing, and providing technical assistance to the city as it returns to some semblance of normalcy. Turning to our budget, I would be remiss not to note the impact that mounting our response to COVID-19 has had on our performance measures. Regardless, we remain committed to our mission and have begun extensive planning to resume, albeit somewhat modified, our normal operations. So are we on the next? So as I stated in my opening statement, even during a global pandemic, we remain steadfast in our mission to protect health, eliminate disparities, and enhance the well-being of everyone in our community through education. Education coordination, advocacy, and direct service delivery. We are committed to maximizing our resources to serve the city as best we can. As with all other agencies, we made tough decisions around our budget with the focus on having the least amount of impact possible on services. The overall reduction impacts include loss of social marketing around key messages like safe sleep, and potentially increased audit findings related to reduced ability to monitor subgrantees, decreased response time and completion of animal-related investigations, disruption in public funding or disruption in funding to support response efforts to the opioid epidemic, delays in instituting billing in the next year to better integrate clinical services in the health department, and hindrance and delays in our ability to meet facility inspection targets mandated by the state. Next slide. While we remain committed to providing public health support in all our target areas, we have identified 6 more focused operational objectives around the COVID-19 response. Minimize the spread of illness, outbreaks, and death as a result of COVID-19, support our most vulnerable populations and our healthcare workers, first responders, and others from COVID-19 infection, support medical surge planning and coordination across city hospitals and post-acute facilities, minimize reduction in the level of city services provided during and after the pandemic by increasing protections and resiliency to the city workforce, and provide recovery strategies that will enable the city to return to normal operations as soon as possible after the pandemic. Since March, though a lot of efforts rather have been shifted toward the response to COVID-19, we've maintained some level of services for a number of other key functions of the department at a reduced capacity in a way that protects both residents and staff. We have completely restructured the department and have deployed approximately 300 staff members from various programs to other service areas that align with these critical objectives. We've worked jointly with the Emergency Operations Center to identify, assess, and respond to emergent issues stemming from the pandemic. Our estimated costs attributable to COVID-19 response through December 2020 is around $47.5 million. We anticipate reimbursement to come through the CARES Act, FEMA, and other federal, state, and local philanthropic funders. Our response is essentially broken down into 4 functional areas: operations, logistics, planning, and administration, with the majority of our funding going towards operations. Operations includes things like our case investigation and contact tracing work, our support of isolation and quarantine sites, the emergency food plan we have for older adults, and our testing efforts. Logistics speaks largely to our PPE and sanitizing supplies, purchases, and distribution. Administration and planning focuses on covering the cost of staff that have been redeployed that are no longer able to be supported by grant funding because they are focused on the COVID-19 response, as well as our public health messaging and marketing. one more, I'm sorry. So as we shift to review our service areas, we'll start with our clinical services, which includes our lab, our STD, HIV, and mobile clinics, as well as TB and oral health services. Collectively, these sites see more than 18,000 people annually. These sites are often the safety net provider for residents who otherwise wouldn't have access to care, and they also serve residents with substance use disorder. This service receives a number of grants related to operations of health clinics in Baltimore City, and the budget also includes federal grant funding for sexually transmitted disease infection prevention and a state grant for mental health. Right. Service 305 is the area serving residents with asthma as well as possible lead exposure. So this team performs over 1,200 home visits annually, and the recommended budget includes 6 new state-funded positions as well as additional state funding to enhance the childhood lead poison prevention program. The budget invests $1 million in general funds to continue the Healthy Home program in order to address major home-based sources of chronic health issues through services, and this also includes home visits for children with asthma, inspections and education for pregnant and postpartum women in hazardous housing, and blood lead testing promotion for all children ages 1 and 2 years old. Service 307 is focused on our support of substance use disorder and mental health services. This includes funding to Behavioral Health Systems Baltimore, the system of care that addresses emotional health and well-being and provides services for substance use and mental health disorder. The proposed budget includes over $495,000 in new state grant funds from the Overdose Data to Action program, a 3-year cooperative agreement with the state. The funds awarded as part of this agreement will support the health department in obtaining high quality, more comprehensive, and timelier data in overdose morbidity and mortality and using those data to inform prevention and response efforts. Next slide. Service 308, our maternal and child health program, operates services that promote positive birth outcomes, including a nurse home visiting program, provides services to infants and toddlers identified with developmental delay, provides nutritional support to families, provides family planning services, and performs our infant and child fatality reviews monthly. The fiscal 2021 budget includes $3 million of support for the programs delivered by Family League and staff within our Bureau of Maternal and Child Health that provide home visiting services for at-risk expectant mothers. These home visiting programs work to reduce factors such as substance use, high levels of stress, preterm labor, and chronic health conditions such as hypertension and diabetes. Service 310 is for our school-based health services, which provides delivery and coordination of health services and health suites in our school-based health centers and serves more than 84,000 students enrolled in Baltimore City Public Schools. Its priorities include early nursing intervention in elementary schools, skilled nursing management for children with special health needs, mandated screening for hearing and vision impairments, mandated immunizations, healthcare case management, and coordination with other services including primary care, mental health, and substance abuse services. The Cohen bill mandates that Baltimore City must maintain fiscal 2019 levels of resources for schools with concentrated poverty in fiscal years 2020 and 2021. The fiscal 2021 budget supports an additional year of bridge funding support for school health in the amount of $13.4 million in fiscal 21 over the fiscal year 17 baseline level of support, with $4 million of that coming from fund balance. Service 311 promotes health, improves the quality of life, and prevents the premature institutionalization of older adults in Baltimore City. It is comprised of our adult evaluation and review services and the Medicaid waiver program. This includes home evaluation of older adults to understand their needs and identify services needed that can be provided within their home so that they can age safely in place. Service 315 includes acute communicable diseases, our Office of Public Health Preparedness and Response, and field health services. ACD and OPHPR help to address urgent public health needs in Baltimore City and respond to public health emergencies. Our COVID-19 pandemic response has been department-wide. However, ACD and OPHPR have been a large part of the backbone of our response to date and will continue to be. Field health services helps with patient transport of chronically ill patients to medical appointments, and they have continued to support this at a reduced scale during the pandemic. CARES funding will help support current efforts toward disease investigation and public health preparedness until December 2020. Service 316 encompasses our Office of Youth and Trauma Services. This services uses public health and human service models to provide mental health and other stabilization services to victims of violence and other residents impacted by trauma. This service conducts citywide trauma trainings and violence prevention programs in city schools and provides important consultation and feedback to the Child Fatality Review Committee. Next slide. Service 715, or Health Department Administration, includes coverage for the executive leadership teams, external affairs, fiscal services, human resources, facilities and maintenance, grants and policy development, and epidemiology and planning. Administration provides departmental leadership, facilitates and guides the agency's delivery of services, and ensures agency compliance with city, state, and federal laws, procedures, and standards. Service 716 is the Office of Animal Control. This service line enforces all codes, rules, and regulations to improve the health and safety of residents in our animal population. It also protects residents from zoonotic diseases and animal attacks and protects the animal population from neglect, abuse, and cruel treatment. This service also includes the Baltimore Animal Rescue and Care Shelter, or BARCS, which provides animal shelter services, including housing and care for shelter animals, lost and found, pet licenses, adoption, volunteer, foster, rescue, and low-cost vaccination and microchip clinics. The budget reduced BARCS funding by $255,000 and a one-time general fund appropriations for BARCS relocation to Cherry Hill, which has now been completed. The budget also defunds one vacant position, which is an animal enforcement officer, and some reduction in professional services. Next slide. Service 717 includes environmental inspection services, or EIS. EIS protects public health by conducting inspections of food service facilities and other facilities requiring sanitation to ensure compliance with state and local health codes. EIS includes food control, ecology and institutional services, and the plan review program. Together, these units license and inspect food facilities, schools, swimming pools, institutional facilities, and tattoo operations to ensure the health and safety requirements are met. EIS also investigates environmental nuisances and potential hazards such as odor, mosquitoes, noise, sewage spills, and foodborne, vector-borne, and waterborne illnesses. Due to COVID-19, EIS started conducting virtual facility inspections that were in the plan review process. EIS staff has also been reassigned to support the COVID-19 response efforts, including the 24-hour support of our isolation and quarantine of vulnerable populations, call intake and triage for the acute communicable disease program, and assistance with PPE storage and distribution. Next slide. Service 718 is the chronic disease prevention program, including tobacco enforcement and cessation support, Baltimore food access initiatives, and systems coordination work around cancer, diabetes, and heart disease. This budget continues to fund the AARP Baltimore Senior Food Access Program and defunds one vacant position as a part of citywide savings, which involves a program coordinator or nutrition education position. Service 720 is focused on HIV treatment for the uninsured or underinsured. It consists of the STD and HIV prevention programs, AIDS and case management programs, and the Ryan White Part A program. The Ryan White program provides comprehensive treatment services to HIV-positive individuals living in the city, and AIDS case management is a service available for the uninsured and underinsured residents living with HIV. The health department also continues its syringe exchange program, which includes the Staying Alive program that trains individuals in responding to opioid-related overdoses with naloxone and other interventions. This initiative has trained more than 40,000 residents and observed a significant increase over the past year in clients reporting overdose reversals. Service 721 focuses on older adults aged 55 and older, persons with disabilities, and their caregivers to facilitate residents maintaining healthy and active lifestyles in their community while aging with dignity. The health department operates 6 senior centers and provides support for 8 nonprofit senior centers across the city. $644,000 of general funds were moved from Service 722 for rent costs for the Waxter Senior Center and Benton Building. This budget reduces allocations to the John Booth Senior Center by about $9,000, and there will be minimal impact for this upcoming fiscal year. Service 722 includes administration and care funding, and current funding here supports the rental property payments that I indicated. Service 723 supports advocacy for older adults. So advocacy and support services include screening of our older adults with disabilities, linkage to information and resources through the Maryland Access Point, referral counseling and complaint investigation for nursing home and assisted living facilities, application assistance, benefit enrollment, establishment of in-home care, and case management services for older adults. Also includes programs such as the State Health Insurance Program, Senior Medicare Patrol, Long-Term Care, Ombudsman, and Senior Information and Assistance. This service continues to receive state funds to support positions for the Ombudsman program, which addresses complaints and advocates for improvements in the long-term care system. Service 724 provides support and/or direct care to Medicaid-eligible, cognitively impaired, disabled, and/or chronically ill individuals who reside in their homes, assisted living facilities, and/or institutional settings. Programs include the Adult Public Guardianship Program, Senior Care, and Subsidy Housing. This service will maintain its current level of funding. Service 725 supports older adults and their caregivers with programs addressing core needs, including nutrition, transportation, and health education and promotion. Most of the programs provided under this service are delivered through contracts with other providers. The budget does support expansion contracts with Salvation Army and the Meals on Wheels program to provide home-delivered meals to food insecure older adults in Baltimore City during the pandemic. In summary, I appreciate the opportunity to present our fiscal year 21 budget. We're committed to protecting the health of city residents and will work effectively within the budget outline to serve those residents. Thank you.
Dr. Jaraza, thank you very much. Taking the presentation down now, I just want to thank you for everything that you're doing and the health department is doing throughout this pandemic. I'm sure you're going to be showered with thanks this evening. We're going to start off with Council President Scott.
Thank you. Thank you, Mr. Chair. Thank you, Dr. Raza, for all of the great work that the health department has done, especially as we go through this COVID-19 crisis and pandemic. You guys have done fabulous work in a very tough time. So let me thank you on behalf of all the citizens of Baltimore. My first couple questions are related to Service 718, chronic disease prevention. So I see that the proposed budget reduces the positions in that particular service of the agency. And while we're in this COVID-19, this is highly concerning to me. Can you talk about the impact of services that those proposed cuts might have?
So the one position that I indicated, and I'll may turn it over for additional support, was the program coordinator nutrition education position. I believe this is a position that was vacant. We won't necessarily be providing through this particular position education around nutrition. But again, I think we'll try to minimize the impact as much as possible based on the staffing that remains. And I don't know if, I think Deputy Commissioner Haller is on as well, if she has any more to add to that.
Yeah, because I'm also seeing a program coordinator position cut, and a community health educator in addition to, but that's from a state fund. The community health educator position from the state fund.
Yes, actually, if Kamala Green is available.
Okay, perfect.
I have a little bit more detail on that specific question.
If you're talking, Kamala, you're muted.
Can everyone hear me?
Yes, we can hear you.
Okay, there we go. Good evening, everyone. So that particular position was responsible for providing nutrition education, coordinating virtual supermarket activities, as well as the landscaping of food access and resources for the health department. So what we're planning on doing is cutting back the nutrition education pieces, but keeping the other pieces. So the current person who oversees virtual supermarket will be taking on coordination of virtual supermarket, as well as looking at our landscaping through one of our interns. So the major piece that is gone is nutrition education, and the only way that we can kind of suffice for that, we'll be able to use an intern to cover some of that, but it won't be covered completely.
Thank you. Thank you. Thank you. And for my colleagues, I think this is one that we should note as we go throughout the budget process down the line. Thank you for that, because I think this is a critical service, especially when you're facing the issues that we're facing in Baltimore, and knowing that many more individuals are going to be in need of healthy food because of COVID-19 and people losing their jobs, that we should strongly consider not doing away with this position especially at this particular time. Dr. Raza, my next question is the question that everyone's going to get from me. We are currently in the first fiscal year budget cycle implementation of the equity assessment program. Can you talk about how you worked this budget that you presented with finance through a lens of equity?
Sure thing. I'll actually turn it over to Chief of Staff Haynes to answer that question.
Yes, good afternoon, Council President, members of the committee. With respect to the equity work that's been led by the Office of Civil Rights, the Health Department has, appointed our equity officer, Kelsey Johnson, who is a member of the leadership team at the Health Department. To date, we have completed a draft of the department's equity plan and have completed the equity assessments that have been prepared by the Office of Civil Rights. Our next steps with respect to to our equity plan is to get more robust feedback from throughout the department. But as you can imagine, some of our response activities related to the pandemic has made it a little bit difficult to pull many members of the department together at one time to begin to discuss this work. But in the coming weeks, we anticipate having conversations around our equity plan in anticipation of sharing that with the Office of Civil Rights in anticipation of the full rollout beginning next fiscal year.
Thank you. Thank you. That is, especially with you guys leading us on COVID, that is actually a very, very wonderful answer, and it pleases me. But I'm not surprised, as I know that it is a very top priority for the Health Commissioner and everyone in the Health Department. The next service I would like to talk about, and this will be my last question for now, Mr. Chair, and we can go back around, is Service 717, Environmental Inspection Services. It would not be a budget cycle if I did not ask a question about this service. And really my question to you, Madam Commissioner, is that I am concerned that we are losing a position in a service that we know already is underfunded and does not have the resources that we need. And can you talk about also, my gut tells me that because of COVID-19, we are probably going to be working our inspectors as we move towards reopening in a unique and different way, which will probably be caused to have more of them and not less. Can we talk about both this fiscal year proposal's impact with the cut and what that would mean, but also what COVID would push, the impacts of COVID on this particular service?
Sure thing. So with that, I actually will turn it over to Deputy Commissioner Howler to speak more about the current impact and potential future impact.
Thank you, Council President. Thank you, members. This is a very tough year for cuts, as we all know. And it was a very difficult decision with regard to this particular position. We are doing some workarounds for some of our inspections at the moment, because so many food facilities are closed. That actually helped alleviate some of that burden. This was a vacant position, and steps were taken to remove vacancies. Our assumption is that it is salary saved. If the fiscal outlook is rosier in years to come. We surely hope to restore this position, but it will have an impact. And in particular, the one piece is that this impact is an impact that all of the jurisdictions are going to be dealing with. In terms of meeting our state mandates, each jurisdiction is now facing this very issue. So we will just be trying to work as diligently as we can to get as many inspections done as we can possibly get done, while we're still trying to keep the public safe.
Thank you. Thank you for that. I'm done for now, Mr. Chair.
Thank you, Mr. President. Again, Dr. Shiraza, I want to sincerely thank you for all the work that you and your team have been doing. Specifically want to highlight Mary Beth Haller and Jeff Ambrose, who have both been absolutely phenomenal responding to stuff in the middle of the night, on the weekend, et cetera. And I think it's really a testament to you and your leadership and your senior team, why Baltimore is in the position it's in right now. It could be catastrophically worse if it wasn't for those efforts and those people. I want to talk about two things non-pandemic related. The first is Service 716, Animal Services. We don't have a function in city government to collect dead animals. If there's a dead rat, a dead cat, a dead raccoon, dead squirrel, etc. And we oftentimes go back between solid waste and DPW and animal control. I was hoping that we could just get a commitment that health department would be willing to work with solid waste moving forward to try and figure this out. I don't expect it to happen tomorrow or next month or anything like that. But I just wanted to get your thoughts on that.
Yeah, I'll turn it over to Deputy Commissioner Haller for that as well.
Thank you, Dr. Shirasa, and thank you for the question. We actually do still do dead animal pickup, and that duty is shared also with DPW. What happens is that the time frames are longer, but we do have a specific day where that is what is done on that day. So it is still a service we offer, but you're absolutely correct. In 2013, as part of the budget cuts then, we lost both of the drivers whose primary responsibility was that specific duty. But it is still happening. There are, just so that the public knows, for very small animals or rats, those aren't animals that we would be picking up. It's really large rat, dogs, cats, larger animals that we, deer and the like, that we would be providing that service for.
Yeah, I get it. I think, we have rats in Baltimore City, and eventually they die, and they die on our sidewalks and on our streets, and they attract bugs. And I know it's small, but it's a quality of life issue. So I think we got to figure out a way to start collecting dead rats off the street. I know this is very small in the COVID-19 world that we're living in, but I would just hope that we can find a way to work with DPW to figure that out. So I would appreciate if, Mary Beth, if you could work with Mr. Chalmers over at Solid Waste and see if we could come up with some type of solution. The other thing I wanted to comment on, Service 717, Environmental Inspection Services. Mary Beth, I just wanted to thank you for all the work that you've been doing with the mayor's COVID-19 Small Business Task Force. What we're able to do in terms of expediting applications for outdoor seating. I think this is a classic example of an existing process that is flawed and burdensome on the small business community. And the way that you were able to play a role in helping to expedite that process. I think anything that we can do in terms of, easing the burden, not only for small businesses, but for your staff, is a win across the board. So I would just offer my comment that I would hope you would be encouraged to continue to think innovatively like that, to help speed these things up so that we can deliver better customer service. But thank you for all the work that you put into that.
Thank you, and obviously that was a team effort.
Okay, we are going to go in the random order that you appear in my WebEx. Again, the winner is Councilman Bill Henry.
Thank you, Mr. Chair. I'm beginning to wonder who I should be thanking for the fact that I always show up first in your WebEx. So first, well, I guess I should pile on with the thanks and the praise. We really do appreciate, Madam Commissioner, everything that you and your team are doing. Jeff, I'll talk to you later. Let's see. First, on page 183 of the detail, I had a question for service 307, the substance use disorder and mental health. There's a performance metric, percent of clients retained in outpatient substance abuse disorder treatment for at least 90 days, that has consistently, there's been a metric for it, and the department seems to be having an issue. What do you need in terms of additional resources? What do you need to hit this number?
Sure.
What's
That's a
going
great
on here?
question. So I'll answer it, and certainly if one of my deputy commissioners wants to chime in, specifically Deputy Commissioner Martin. So we were looking to do an overhaul of some of our metrics, and 307 is one of them. We work with Behavioral Health System Baltimore as our partner supporting substance use disorder treatment and mental health. And this is just not a metric that they typically collect. There are other metrics that they look at for some of their state funding dollars. But between the transition with a new health commissioner and then cybersecurity, like just lots of kind of a chain of events. That's a metric that we plan to update, and we'll certainly like to update before next fiscal year.
Okay, so it explains the not applicables for the current and the, gotcha. Okay, thank you. Then the second question I had was under service 717, the environmental inspection services. Since the inspectors have been working on your COVID-19 response efforts, how do you plan to handle the workload as things start to reopen? So it's a two-parter. Let's do that one first.
Yep. So we are actively looking at staff that is currently on permission leave, and trying to figure out how we can reslot them into positions that are directly supporting the COVID-19 response. And we're looking at positions across the city, not just within the health department, as we've already redeployed a number of staff, but looking at other agencies. So I'm working with DHR as well as the Office of the Labor Commissioner to understand of staff that's on permission leave now in other agencies who can be repurposed to fill in those roles. So they've received a job description. We've received a list of individuals who volunteered, and we're subsequently planning for shadowing and training in the coming weeks to transition that EIS team out of there and other team in.
So you said over the next couple of weeks. So what's the time frame?
So ideally in the next week or two, honestly.
Okay.
So we've already reached out to a number of individuals that we're planning to slot into roles.
Okay, that's great. And then the last question, if residents have concerns about businesses that are not following the guidelines in terms of PPE, in terms of what they're supposed to be requiring of their customers, how do they report that?
So they would report it via 311. So that's really the best option for reporting any concerns or complaints.
All right, so the call center already has that as a new thing that they can fit reports into easily, and it'll get to the right people in your agency.
Yes.
Okay, thank you. That's great. Thank you so much. Mr. Chair, thank you.
Thank you, Vice Chairman Pinkett.
Thank you, Mr. Chair. Once again, just like has already been said, Dr. Girazzo, I just want to thank you and your team for the exceptional work that you're doing on behalf of our city. I know that Baltimore, despite its challenges, has come through or is going through this pandemic in a much better condition because of the work that you all are doing. So thank you again. My first question is related to Service 316, Youth and Trauma Services. And I think it's rightfully so, that the description of this service says this work is critical to break the cycle of violence in Baltimore City. And then when I look at the number of victims served, you all are doing a commendable job in serving, almost double your target. I know that we are in a position where citywide savings or cuts are being asked. I just don't know how we make a cut to this particular activity when we know how critical it is for our city and the violence that is prevalent in this city. And I don't know if that's more of a statement or a question. I just, if there are any categories or activities or services in this budget that should not be cut, this is one that should not be touched. And matter of fact, it should be one that we are trying to find additional resources for rather than taking any resources out. So I don't know if you can speak to, I know it was a difficult decision, but can you speak to some of the decision that went into even considering a cut in this service?
Sure. So I will actually turn it over to our Director of the Office of Youth and Trauma Services, William Kellebrew. Before I do that, I will say in making decisions around cuts, we really try to take a very global approach and look at positions that were vacant and maybe had been vacant for some time as a part of our overall decision making. And so we really did systematically go to each division or office and try to be equitable and fair across the department when making those decisions. I think William can speak a little bit more in detail to that specific role.
Good evening, council members, council president. Thank you, Dr. Jarasa. Yes, we do understand. I really agree with Dr. Jarasa at this point that it's very equitable to look across the board, and everybody had to put in something across the board. And we felt that way. But at the same time, we do synergize with what you just said, which is it was a very hard thing to look at to cut this position. If there is funding that's available for this position, we would certainly take that into account. It's really supporting the HCA Act that was just passed recently, and so we see it as a critical role. So I'll just leave it there unless there's a question about the position or what it may entail. Or
no, I just couldn't look at the budget book and not pause at the cut in this particular service. In light of the justification of the position, I mean, clearly you are already exceeding the target, but I would imagine that even the actual for fiscal 2019 is probably a low target when we think about the need in our city. And so that's the only reason that I brought it up. So thank you for that. My second question is from Service 307, Substance Use Disorder and Mental Health. I know Councilman Henry already made mention of this particular service, but I wanted to just get some detail as it relates to, I guess, the third output, number of clients receiving substance use disorder services. I know that the footnote says that in fiscal 19 that it exceeded the target of 26,000. I don't know if there's an error in the book, but it looks like the target in the graph says 40,000. So what was the actual target for fiscal 2019? Does everyone see what I'm referring to? And if it's an error, then that explains it. But if the actual target was 40,000 and we achieved 5,000 less, then I'm curious the reason why.
Is that something we can get back to you on? Would that be okay if we can write that question down and respond back to this group on that?
Yes, that's fine. Thank you. Mr. Chair, that's my first two questions on this round. Thank you.
Thank you, Councilman. Councilman Burnett. And then we'll be followed by Clark, Middleton, Cohen.
Thank you, Mr. Chair. Again, it's been said already, but just want to thank Dr. Terrazas and your team for the excellent work on the continued COVID-19 response. The JIC council member, it's been great working with everybody across all the agencies as well that have given a tremendous amount of time to help us navigate this pandemic. So it's been excellent working with you and your team, excellent working with all the agency staff that has been a part of that response. So just wanted to start there. I had a couple just really quick areas that I was hoping to get some clarity on. Wanted to start with Service 303, clinical services. It was mentioned that there was an impact on data entry and a reduction in client visits. And the performance measures reflects that. Just wanted to see if there was a quick update on when the appointment data for STD services, it's on page 175 of volume 1, would be updated for that performance measure. As you can see, it dipped pretty significantly from the prior years.
And I don't know if Deputy Commissioner Martin, while I look forward, if she has anything she wants to respond to regarding that particular question.
Sure. Thank you, Dr. DeRosa. Councilman Burnett, we are still in our clinical services programs recovering from the ransomware. And during the ransomware, we had to very quickly switch to all paper-based client visits and records, including in our lab. And while we had been working to get all of the paper records entered into our electronic medical record prior to the pandemic, we have not yet been able to fully transfer all of those paper records into our electronic medical record system yet.
Okay. Yeah, that seems very, very tedious. Just, I guess once it's updated, if you could share it with the council, that would be helpful for us, so we can just kind of see where things are going on that front. The other really quick question I had, Mr. Chair, was on, there we go. Back to actually the earlier questions about environmental inspection services. Can you walk us through, Dr. Terrazas or one of your staff members, on the virtual inspections, what those look like, and when they will be reconvening those? But I'm just curious as to how that goes for the inspector.
Sure. So I will turn it over to Deputy Commissioner Haller.
And I'm actually going to let Jessica Speaker speak to that. I can speak a bit to the plan review one, but she has more information on what things are going to be looking like going forward.
Hi, good evening, everyone. Yes, so right now we are conducting virtual inspections of our plan review. So those are the change of ownerships and new ownerships, anything that needs to do any kind of upgrade. Those are all being done virtually. So we have 3 inspectors that are working off of their iPads and conducting inspections with the owners. And they walk through the entire facility. We ask them to do anything, they show us that way. And once we can get our staff all back online, we will be conducting virtual inspections of our regulatory facilities.
And sorry, what are the regulatory facilities?
What you would consider like a regular inspection. So all the food facilities, bars, liquor stores, that kind of thing.
Okay. All right. Thank you. That's all I have, Mr. Chair. Everything else I was going to ask has already been answered.
Thank you, Councilman Burnett. Please forgive me if I mix up the order that Councilman Costello called out, but I think Councilwoman Clark was next. You're on mute, Councilwoman.
First of all, Commissioner, thank you so much for your wonderful leadership and for your team. The health department does a wonderful job in so many directions every day. I don't know how you keep track of it. And we have a lot of respect for you across the city. Thank you. So in general, I would just like to say, I went through this budget and I was alarmed by how many vacancies were being eliminated. The reason for that is the many vital things the health department does and the tradition of city government to rely on this agency living off federal and state funding and very little general funds from the city. Meanwhile, we're all getting hundreds of emails a day on another subject that shows a trend toward more and more of what a police department does belongs in a specialty like a trauma, a place that is a place where people are professionally trained and involved in trauma to prevent things from happening, to help people, or it's a crime issue. So what I'm saying is, what I wanted to ask is this. Are you underfunded? You gotta be, because I went through the whole budget and saw vacant positions, so you weren't hiring. This is not a criticism. This is my saying, gee whiz, we rely on y'all and you're doing the basic work of the world and you're losing personnel left and right. And it's going vacant, you can't hire, there's a freeze that I guess affects you, the health department, and then it gets, those vacant positions get deleted, and seems to be going in the wrong direction in terms of what the city should do to support the health department. So what I was going to ask you, what are your greatest needs in terms of personnel, and how can we help you get what you need to be able to be at full staffing? I know you're running the homeless, that you're running the whole city in terms of the COVID-19, and you're our leader, but you need more help in all these agencies, in parts of your agency. Are you getting, Madam Commissioner, are you getting the kind of personnel support that you need to be able to be at least at a normal kind of operation?
Well, what I would say, and I appreciate all of the thanks and the accolades that I've received from
Sure.
this committee thus far. It is absolutely a team effort. And I would say that my team has been outstanding. So
Well, we know
the
that.
resources that we have, they've made the most of what we have. People have cross-trained and are wearing multiple hats throughout this response, while some of them are still also supporting their regular roles. And so I have been impressed and overwhelmed by how amazing the team has been since we've been in this pandemic. Additionally, I think what COVID-19 revealed nationally and certainly internationally is that public health in general is largely underfunded. I think it's a area that is undervalued. We have seen, on a national level where larger agencies that fund us, the CDC, HHS, have made considerable cuts to support in public health, and now we find ourselves in a pandemic where there's also recognition of just how important public health is and the need for a strong public health infrastructure is. So again, I think our team has done an amazing job with the resources we have, and we'll continue to advocate for additional funding to support these current efforts, and really all of the development of our public health infrastructure and public health workforce so that we can continue to do this great work.
Well, you're very gracious. I would just like to say to my colleagues, the world is changing, and one of the ways it's changing is it's moving a lot into the arena of public health that has been in different places for years. And I think that's a good move, but only if City of Baltimore acknowledges what's happening and begins to put our money where the drift is, where the movement is, which is where you are. I did, since I wrote it all down and worried about it, and everyone else has talked about it, I would like to, for my second just statement, say that from all the services, I'm worried about inspectional services. I'm worried about, everybody's doing double duty now in the health department and doing it very, very well and without complaining. Let me just take this one service that other people have spoken about. And I know that that you're doing everything you can, but remember, part of what we're in the middle of now is businesses now trying to get reopened again, trying to pass all the guidelines, trying to not just ensure the health department, but ensure the general public customers that they're a safe place to be. And so therefore, with that effort going on, we need the professional inspectors that we've had for years, and they're already doing double duty. You need more staff. And I think you do, because there's a lot of hand holding that's going to have to happen out there with your inspectors and people desperately trying to get their places back into business. So I just say that. I know you're going to say everybody's doing a great job and so are you, but my job is to say, help. Okay? Thank you. Thanks. Thanks, everybody.
Vice President Middleton.
Thank you, Mr. Vice Chair. So I guess my statement and question is a good segue from after listening to Councilwoman Clark. As you all know, I serve on the Commission of Aging.
Yep.
But before I get into that, Dr. Gerazi, I would be remiss if you are doing a wonderful job. The time that you came in and took off, and it's definitely a team, but a team has a leader, and you are definitely leading well. So my hat's off to you, and also, and of course your team, and also a shout out to Commissioner Tan, which has been working hard and very patient with the Commission of Aging, and the changes that are happening are all positive things within that commission. Of course, it takes money to get that moving, but I did notice that I don't know if these decisions happened after COVID, but we all know that during this COVID, how vulnerable our seniors are, not just because of the disease and how people 60 and over are the vulnerable population, but this pandemic showed, our food deserts, how food has to be delivered to our disabled seniors. Evidently is not muted.
Oh, is that me?
Oh, okay.
Oh, that is me.
Okay. Oh, okay. So, I did notice that just about every senior segment you did give money to, which kind of shows to me, improvement. If I'm not mistaken, it looks like it was an addition from 2020. This fiscal year 2021 has just about in every segment, from senior centers to the advocacy for seniors to just every segment, there was some increase, which I was just so elated that that is happening. Small amounts in some places, but it is progress. And I think people really can see the help that we need with our seniors. Our youth and our seniors right now are the most important things going forward. And I think you took a step to show that you are paying attention to this, and hopefully things are going to continue to move forward. My question is, I know you're working on advocacy for seniors. Even in the commission, we talk about marketing, how to market things and market our senior centers. Can Commissioner Tan explain if there's some new marketing ideas that you have? And also, that 211 was so important, and especially with just them having one number to call for whether it was food or a place to get testing. I mean, this city really, I think, utilized that simple 211 call. Is that going to continue even after COVID? And then the marketing piece. Can you?
Sure. So I'll start with 211, and then I'll turn it over to Deputy Commissioner Tan to talk a little bit about marketing. So the 211 call center was a part of our public-private partnership that the city formed early on with Care First, Hopkins, and the University of Maryland Medical System. And Care First has been the partner that has provided the clinical support on the back end of 211. So while 211 is kind of the outward-facing number for those that are inquiring about COVID-19 specifically, they're redirected to a clinician through the Care First call center. We've worked with 211 in other partnerships to be a resource. We've also very much ramped up support for our Maryland Access Point as that kind of one point of entry for older adults. We expanded the capacity. I think we, and Deputy Commissioner, I think we almost tripled the capacity of people working in that Maryland Access Point to be able to provide that additional service. So we'll always have the Maryland Access Point. I don't necessarily know that 211 will always be kind of that front runner ahead of it, but Maryland Access Point will certainly remain as a resource moving forward. And with that, I'll turn it over to Deputy Commissioner Tan.
Okay.
Are you there, Hyung? We see that you're off mute, but we can't hear you.
Deputy Commissioner, are you with us? It doesn't appear that she's connected. So,
good evening. Can you hear me?
Yes, we can hear you now.
Yes, I apologize. Thank you, Councilwoman Middleton, for your question, and thank you, Dr. Shirasa, for your support with 211 and the Maryland Access Point. To answer your specific question around marketing, yes, we are engaging CCP, the Center for Communications program at Johns Hopkins, to help with a lot of our marketing. Particularly with the COVID response, we engaged them to help with the Lean On campaign. You've seen that roll out with the food access program, as well as other areas. Knowing that older adults will continue to be vulnerable during the COVID response, we've engaged Johns Hopkins for their support in helping us with various marketing and branding efforts throughout the next several months.
Okay, thank you. So back to Care First. So it sounds like maybe the council can also be your advocates in helping and talking to Care First to try to keep 211 going the way it is as long as we can past the COVID. Would you say that's a correct statement?
I would want to talk with Care First, and part of it again is that the clinicians supporting on the back end have been redirected from our clinical partners. So they also have to get back to whatever their previous role was as hospitals are also expanding services. But we are in conversations with Care First to understand how we can best utilize that line moving forward, and it's good to hear that it was a service that was much appreciated by residents. So we're happy to take that back to them.
Okay, thank you. That's all.
Councilman Cohen.
Thank you, Mr. Vice Chair. Thank you, Madam Commissioner. To reiterate the kudos from all my colleagues, you obviously stepped in a really tough time with the ransomware, and then it only got harder. So we appreciate all that you've done, and especially want to say I appreciate you partnering so closely and William Kellebrew on the Elijah Cummings Healing City Act. It's been really, really good working with you on that. I did want to reiterate a point that the Vice Chairman made and Councilman Clark, but to sort of make it in a different way and to maybe direct it to Mr. Seneme. So we're in a time where we are continuing to experience, despite being in a global pandemic, an unrelenting amount of violence within our city. The day-to-day trauma of racism has never been more front and center. Additionally, we are experiencing an unprecedented mental health crisis with COVID-19, increased isolation for seniors, depression, anxiety, increased rates of child abuse and intimate partner violence. Young people are out of school. Parents are incredibly stressed out. And we're at a time where our council just passed landmark legislation on reducing and responding to trauma, which really makes Baltimore a national leader in trauma responsive care. So given all of these factors, why on earth would we cut from Service 316? Why would we cut from Youth and Trauma Services? I would ask you, Commissioner, and I will say to Mr. Seneme and the budget team, that to me is a completely unacceptable cut. And it's kind of tone deaf, just given what youth and families are experiencing right now. And so I know that for you, Commissioner, this is a priority. You came in and said as soon as you got confirmed, this was your priority, and you've completely and totally followed through, as has William Kellebrew, in your partnership on the Elijah Cummings Healing City Act and in really trying to implement that legislation with fidelity. So look, if we're talking about equity, cutting from youth and trauma services, even if it's a small cut, is not it. And in fact, we should be doubling that service because the needs have grown exponentially from the time even we got into COVID-19. So, again, I would ask for your response, Commissioner, but I also pose this to Director Seneme because it is a real glaring problem for me at a time when, and again, I will say, my colleagues have said this before, our inboxes are flooded with thousands and thousands of people asking us to cut from the police. Why on earth are we cutting from a service which would reduce the need for police?
So I can respond to the direct question about the budget process and our thinking. So as you know, I want to remind everybody on the call, we're not in just a health crisis given the pandemic. We're also in a financial crisis too. We had to make some really tough decisions in probably a 2 to 3 week period. And the approach that we took when we went through that back in March and into April was to look to ways that we could minimize direct service impacts before we went and actually cut direct services with people and layoffs. And so the approach we took was we asked all agencies, and that included health, to look at first to see if there were any vacant positions that they could go without for a period of time during the recovery period that we could take the funding away from. And so you'll notice in the overview book, the executive summary book, there's 240 vacant positions that were trimmed across all agencies. That included all the public safety agencies as well, too. So again, the point of taking away vacant positions was trying to make sure that we could only eliminate service if we absolutely had to. So that was the thinking behind it. We gave the agency some, quite a bit of flexibility. We gave agencies general targets and said, look, we need to forfeit a certain number of positions, and we gave the agencies the flexibility to choose the ones that they think would minimize the service impact. So again, not ideal, but I think was just necessary in those in the situation we found ourselves in.
This is just not one that I think we can afford to take any sort of hit on. I think we need to be dramatically increasing spending on mental health and trauma services, particularly for our young people as they come out of this incredibly traumatic period in this pandemic.
Was there a question there?
Nope.
Okay.
Thank you, Councilman Cohen. Councilwoman Sneed.
Thank you. I just want to echo what everyone else is saying. Thank you to your team, Commissioner, and you as well, and for even picking up the phone during all of this to make special to answer personal questions that I had for my community and I. So thank you, thank you, thank you. But I'm just curious about Area 716. I know the Chairman Costello had talked about the animals in the past. And I'm just curious, what are the top priority services that the requests that we get under 716 when it comes to animals and requests? Do we have a list of like the top 5 with the phone calls are based off?
Sure. So I'll actually see if, I don't know, if Jessica Speaker, who runs that office, is able to respond to that.
Good evening, Councilwoman. Yes, the top 5 priority requests, and I'm memory on these, so I might leave one. I might have to get back to you. But it's animals at risk or in danger. There are animal bite cases where an individual or another animal has attacked an animal. There are fire and police standby. Those are in the event of a fire. There are animals that have to be taken out or removed, or police are serving a warrant. It's an internal service request, but we respond to the scene to make it safe for the officer if there are animals on scene. And the last one right now is, I'll have to get back to you on that. But of those, the top 5.
Okay, thank you. And I want to jump.
An animal's injured and at risk. That the animal is injured, at risk, or being actively abused. Yeah.
Thank you. The other question that I had, we get a lot of phone calls, I'm sure, all over from different council offices in reference to tobacco and who's selling loosies. Do we know how many, do we have a list of how many stores across the city for tobacco outlets? Do we know how many there are?
Yes, I believe we do. Kamala?
There are exactly 1,353 licensed tobacco retailers here in the city, but that does not count all of the illegal businesses that do sell tobacco. And we have found some and reported them to the state because the state licenses all of those. So let me also give one education note. We cannot enforce in the city the sale of loosies. We can only enforce the sale to businesses who sell to people under the age of 21.
And so there's no, I guess we can't revoke or we can't block renewal. That doesn't come from us in the city then.
Right, we cannot do that, but we do put the heat on them in a compliance check by doing an educational visit as well as a compliance check to make sure that even if we get a report that a sale of Lucy has taken place, we will go educate them and then we will do a compliance check. So we keep them on our radar and we report those to the Maryland Department of Health.
Chairman, can I ask one more question in reference to? So do we know how many we report, and then when we report them, do we come back to see if they've been like taken off the look, if they've been reviewed for doing?
Yes, so there is a review for every double offender, and let me specify by double offender, if we have cited the business twice, those go to the state comptroller's office and then they send out a field enforcement officer to that business. And if in fact they find that they are negligent and not obeying the state's tobacco law, they will put it under review and then they will either cite them with a bigger fine or they will submit to them a letter slapping them on the wrist. So it is very challenging in our office to ensure that we comply, getting businesses to comply with the sale of loose cigarettes. But equally, we have done a monumental job of educating those same tobacco retailers on all of the laws, whether or not we can enforce them or not.
Thank you.
You're very welcome. Thank you.
Councilman Slifer?
I'm good, thank you.
Excuse me, Mr. Chair, I have one other question. It's okay. Service 718, where it's mentioned the virtual supermarkets, it mentions the one site closing in 2019. Which site was that?
That site was Bolton Hill. That was Bolton North. That was a site that was 2 minutes from a market right there on McMeekin Street. And that is the site that we closed in 2019. So traditionally, the whole purpose of the virtual supermarket program is to really make sure that we provide online grocery services to senior sitting centers where there is no supermarket. And so that was why we removed that, so that we can ensure timely delivery as well as to make sure that all of the other sites were getting the necessary deliveries on time.
Okay, but I'm assuming that that site was selected with full knowledge that there's a grocery right not that far from it.
I think that that site was chosen because it was a senior center site. Okay. And at the time I was not here at the health department, but I think that historically that was the account, was that we chose sites based on if they were senior centers, not necessarily if there was food insecurity.
I know that during this pandemic, there's been a lot of outreach as it relates to food and food distribution. Can you speak to the work of the virtual supermarkets during the pandemic and the role that it's been playing in food distribution?
So I'm proud to announce that the virtual supermarket never missed 1 week of delivery services to all 9 of our senior center sites. We were consistent, and that was monumental because we were working with ShopRite, who has been our vendor since the inception of the program. And literally we had to call to all 9 sites to make delivery changes because we could not use the community rooms because they were huge rooms. They were only used for large groups. And so we had to make arrangements to only deliver to the lobbies or to a side door. And so all of our neighborhood food advocates who work with the program, all of them continue to take orders, which are our seniors who are on site at those locations. They took orders, input orders, and we made it through literally these last 11 weeks of COVID with no interruption to virtual supermarket services. We traditionally were doing about 100+ orders each week.
I had the pleasure of participating in a lot of food distribution, specifically to senior buildings over the past few months. Is there any intent on expanding because there are a lot of senior buildings that are not in proximity to grocery stores. Is there any intent on expanding the virtual supermarket? And if so, have you identified particular locations in the city that are where food access is even more challenging, especially for seniors?
We would love to expand virtual supermarket. And the problem with expanding virtual supermarket is that largely virtual supermarket has been operating off of grants since its inception. That is not a program that is actually budgeted through general funds. It is a program that we have written grants the entire time to keep virtual supermarket going. So our objective this year is to look at additional grants to keep it going. And two, to expand to the east side, because at this current moment, we're only on the west side.
Thank you. I think that it's already been stated the number of disparities that have come to light in a greater way during this pandemic, and food access is, at the top of the list. Just like we can't depend on grants as it relates to, trauma-informed care, we cannot just depend solely on grants as it relates to food access. I think that has been abundantly clear as it relates to food distribution that's happening. I continue to tell people that even if we weren't in the midst of a pandemic, the lines that are at food distribution sites throughout the city would still be there, whether we were facing COVID-19 or not, because the need is that great in our city. And so I know that facing a challenged budget, we still have to figure out how do we make certain that in a city where 25% of our population doesn't have access to fresh, affordable, healthy food, that we've got to be able to provide as many avenues as possible to get food to our citizens, especially our seniors and our children. Mr. Chair, I just had one other question related to Service 720. It's not a performance measure, but I'm just wondering, is it a possibility to measure it in some regards, the impact of our naloxone training as it relates to overdoses? The narrative talks about the number of reversals. Is there any figure out there that speaks to the number of reversals that are happening as a result of our outreach and our training?
Yes, we do get reports back from some of the overdose prevention programs that we work with. So we could get those figures to you.
Thank you. Mr. Chair, I turn it back over to you.
Thank you. I think we've cycled through everyone once. Any council members we didn't get to yet? All right, Mr. President.
Thank you, Mr. Chair. Madam Commissioner, I want to go back to youth and trauma services. I know that it's been mentioned, but wanted to go a little deeper. When we see this decrease in federal funding, of more than $1 million, like for the supporting male survivors of violence program, like how will the program operations be affected by this grant cycles? What does it offer? How many young men does it typically reach each year?
Sure. I'll turn it over to Director Kellebrew to answer that.
Yes, good evening, President, Council President. We are actually in the 5th year of SMSV, we call it, Supporting Male Survivors of Violence, and we typically serve about 60 young men in the McElderry Park community statistical area. And so this year we are in the analysis phase of our evaluation, and so we're not serving youth consistently, but we do have a summer program that will support 30 young people in that same program with youth summer jobs. We're working directly with YouthWorks to be able to do that. But it will end September 30th, 2020. And so what we have done is we've looked at the sustainability of how we serve young people, young males of color, and our program, Youth Services and Advocacy Project, we call YSAP, will take on the role of serving young male survivors of violence, which that program already is funded by the state.
Yeah, and what was the total cost for this throughout the years for the service? And then are you at the point yet where you have any kind of data on how impactful the service was?
So we have, and I would have to follow up with how impactful of the difference that was made. We received $1.66 million from the federal government, and one of the problems with that, one of the challenges with that funding is it's from VOCA funding, which we know Victims of Crime Act funding is not. We don't have a no at cost extension on that. So if we were out of funds, we're pretty much out of funds, and we can't continue the program. But 5 years, $1.6 million.
Thank you. Thank you. Madam Commissioner, just a follow-up onto the conversation earlier around violence, and just wanted to see, as you know, the council passed and it went into law that beginning, I guess, next year, next calendar year, whomever the mayor shall be will have to present a coordinated violence reduction strategy that will be led by you in the health department. Has the department thought about any cost that it might incur for you guys to actually coordinate that, or any assistance that you might need as we move into reimagining public safety in Baltimore and understanding that violence is a public health issue?
Sure. So I mean, I think some of these things were happening maybe right as we were on the verge of entering the pandemic. So can't say that we've given it a considerable amount of thought or planning at this point. But certainly as we think about recovery and how we're bringing services back online, we will give more consideration to that.
Thank you so much. And my last question is in reference to Healthy Homes and the Healthy Homes program. Can you tell me how many kids are enrolled for lead exposure, how many are enrolled for asthma, and how are the children identified? And does the department have an estimate on the total number of kids that could benefit from this service?
Sure. I think Director Schnitzer is on the line, who leads our Healthy Homes program, along with Camille Burke. So I'll turn it over to them to help with the response. Maybe starting with Camille. Camille, if you're talking, you're on mute. Still on mute. There we go. All right, I'll turn it over to Margaret Schnitzer to see if she can respond. I think Camille's having some trouble getting off mute.
Yeah. So, can you hear me?
No. Yes, we can hear you.
Oh, great. So, thanks. So, thank you for asking this question. In terms of asthma, we get our referrals in a number of different ways. So, we get a list of kids who currently receive medical assistance, who are considered by the state of Maryland's Department of Health to be at risk for poor asthma outcomes because they've had multiple asthma home visits, they've had multiple asthma emergency room visits, they have a poor record of filling their prescriptions. So those are the kids who get referred to us. We get a list of kids probably every 2 or 3 months. That list of children with at-risk asthma is about 9,000 children. So it's a huge list. And we take that list and we outreach based on a kind of a risk assessment that we do. We outreach these kids, the most at-risk children. We make phone calls, we send letters, we try to involve them in care. And then we also work very closely with our health partners, so with providers, with emergency rooms, so that when they see kids coming through their emergency rooms and their offices who could really benefit from this additional education, they refer them to our program. Our program is voluntary, so we can't force people to participate, but we do try to make it as attractive as possible. It's home visits. We do it on people's in their home. We bring a whole slew of supplies that can help decrease asthma triggers in the home. So we try to make it both kind of accessible to the families. We do have bilingual staff, so we try to reach as many folks as we can. Our current capacity per year is approximately, it's about 350 kids with asthma. Did that answer your question?
Yes. And what about with lead? Do we know how many?
Yeah, I think, Camille, are you able to get yourself off mute here?
And then, sorry about that, Madam Commissioner, before we go, you said we served 350, and how many do we think are out there that we could serve? You're on mute, ma'am. Hello, puppy.
Sorry, yes, she likes to be with me. There are up to about 9,000 kids we think we can serve. Based on
And are there any, do we have numbers on our partners in health throughout the city and their services that they're rendering and how many young people they're reaching?
for asthma,
Yes.
not really, because it's a very kind of diverse system. There, the health department's program, and then there's a program through GHHI that are probably the only two programs that very specifically serve kids just with asthma. The hospitals have community health workers, but they are versed in many different kinds of diseases, chronic diseases. So I don't really know how many they're doing.
Okay, thank you. And what about lead? Sorry about that, Madam Commissioner.
That's okay. I think Camille figured it out and got herself off mute, or at least she had.
Council President, Camille Burke's power actually has gone out, but I can speak to how the cases are referred for lead. Those are the result of lead tests that come in from labs. Every lab result is reported to the Commissioner of Health and into the lead registry. And that is how those cases come to our attention. For example, in FY19, Camille sent me some numbers here. We have 343 kids were served. But last year, that was the time frame during which what was considered to be a case was 10 micrograms per deciliter or more. And the state is lowering that reference level to 5 micrograms per deciliter in legislation that was passed. So that will increase our caseload. What we were seeing is our higher lead levels were starting to drop, which signals then an ability to then transfer and lower the level even further, because we know that there's absolutely no safe level for lead in a child's blood. And we think that the increase we may experience may be another 315 cases. So those cases represent really then anything above 5 micrograms per deciliter.
So you think we served 315 last year? Is that what you're saying?
Well, 343 last year, and we would expect it may be a similar number this year, but it may increase by another 300 or so because we're lowering this reference level to when we say we should be intervening. It has been lowered repeatedly.
Thank you. Thank you. And my last question, Madam Commissioner, is one, I think that we are doing some of that work in other agencies, including one of the questions that I just asked. But I wanted to ask about, again, I'm going to ask until we actually have it again, about have you guys been able to like reconsider and reimagine Operation Safe Kids? I know that the state claims that they're doing a lot of that work themselves, and wanted to see if you guys are seeing that and being reflected in how you're seeing the services rendered, and also have we considered seeking funding of our own to restart and reimagine that program?
Yeah, so I think again, I mentioned it a little bit in my opening statement. So prior to COVID-19, we were in the latter stages of finalizing an updated strategic plan. And a lot of the metrics we indicated were things that we gathered from a community tour that we did in the fall. So between the months of, I think, August and November, we had about 9 community conversations where we received direct feedback from the community. We also provided surveys. So the phase that we were in was really trying to collect some of that feedback online, as well as do some focus groups with the idea of presenting a plan that would be available for public viewing and public comments for at least 30 days. And again, it's just timing. This is probably in February or so that we were at that point. And certainly one of the things we heard was the need for additional support of young people in the form of mental health, and certainly in the form of trauma-informed care. As we've had to pivot in this response, again, I think we haven't had as much time to think through what that would look like. But as we're planning for kind of recovery and bringing services back online, that will be certainly one of the things that comes up, because we know it was something that we heard often during our community tour. Additionally, we heard about food access as well. I don't know if Director Kellebrew has anything else that he wants to add.
Thank you, Dr. Jarasa. Yes, so that, of course, that program ended just actually the year that I came in 2016, and so there was a difference. We were doing a lot of duplicative work as well with the DJS, and so it was decided that the program would be pulled until we try to figure out what does the continuum look like. And so there are many different things that have happened over the course of years. And so, as to Dr. Jarasa's point, it really takes us to look at our strategy and ensure that we do not duplicate services. And we have been in talks with Director Bernice over at the DJS to think about what does that continuum look like to make sure that we don't duplicate services, such as surveilling young people, but really looking at their needs from their perspective and how we can serve their best interests. So that's kind of where we are, and we're looking at that.
Thank you. Thank you very much.
Sure.
Mr. President, you good?
All good, Mr. Chair.
Thank you. Councilwoman Sneed?
Nope, I don't have any other questions.
Council Vice President Middleton?
No further questions.
Councilman Bill Henry?
No questions, sir. Thank you.
Councilman Z. Cohen?
All set. Thank you.
Councilman Chris Burnett? Councilman Chris Burnett?
All right, I didn't realize I was off mute. I'm good, Mr. Chair. Thank you.
You. Vice Chair Pinkett?
Thank you, Mr. Chair. I just wanted to come back to, because we got some clarification around Service 307 of the fiscal 2019, where it says the target for number of clients receiving substance use disorder services. That target says 40,000 and the actual was 34,964. It appears that that portion isn't the error. And so I'm just curious what occurred where we were 5,000 short of achieving the target of the number of clients receiving substance use disorder services. And that was for Madam Commissioner.
Sure. So I think, I don't know if Deputy Commissioner can speak to that particular line item. Deputy Commissioner Martin, I'm sorry, I didn't say your last name.
Councilman Pinkett, I'm sorry, I'm not certain that I know the answer to that. So is that something that we can get back to you on?
Definitely. I believe it's a critical question and a significant gap, especially when we know the the opioid crisis that, we're facing in the city and the number of deaths that we are experiencing as it relates to overdose, to not meet the target, but not even, we really should be exceeding the target, because that's potentially a life that we save by reaching, those individuals. So yes.
Absolutely.
Thank you, Mr. Chair.
Thank you. Councilman Schleifer. Okay. Colleagues, any other questions? All right, Dr. Jaraza and Health Department, thank you all very much. Appreciate it. We are now going into recess until 10 a.m. tomorrow morning. Thank you.
Thank you.